Dear audience, welcome to this exclusive webinar, and it is our fortunate that we have got today our special speaker, Dr. Rushdy Ahmad, and title of today's webinar is technology, health technology policy, as well as how biotechnology and COVID-19 can relate. And today's guest, he's a lead diagnostic accelerator, Wyss Institute of Harvard University, Boston, Massachusetts, USA. Welcome, Rushdy bhai, and we are grateful that you have made your time to discuss with us.
No, thank you, Shamim. No problem. It's my pleasure. Thank you.
Rushdy bhai, can you just give us a brief description to our audience about your work in direct to the consumer working group, as well as other? I know that you are involved in different other activities. Can you just give a introduction about yourself and your work too?
No, definitely. So let me start from sorry, in Bangla bolchi na karon a scientific term. It's difficult to sometimes talk in Bangla. Kintu ami pura Bangladeshi. Amar janmo borsho England and then amar আব্বাকে হয়তো আপনারা হয়তো চিনবেন ডক্টর কাজী খলিকুজ্জামান আহমদ, সো এটা হচ্ছে আমার পরিচয়। উনি বাংলাদেশে তো অর্থনীতিবিদ and very well known to people in Bangladesh. So আমি আমার স্কুল ছিল সেন্ট জোসেফ ঢাকাতে, তারপর ঢাকা কলেজ, and তারপর 1987 আমি আমেরিকা চলে আসি। So আমার পিএইচডি হচ্ছে in physics অনেক আগে, 20 বছর আগে, and then I moved on to biomedical science. So আমি MIT, Massachusetts Institute of Technology তে আমি পোস্টডক ছিলাম কয়েক বছর, তারপর ব্রড ইনস্টিটিউট, ওইখানে আমি প্রায় 12 বছর কাজ করেছি। I worked on all types of diagnostics for all diseases, যেমন neurological disease, cancer, infectious disease like যক্ষা, TB, tuberculosis, and এখন on COVID diagnostic. So 12 বছর ব্রড ইনস্টিটিউট, এটা হচ্ছে এই বস্টন কেমব্রিজ এলাকায়। After Broad Institute, I left to start a company এবং বাংলাদেশে একটা charitable organization called QK Ahmad Foundation, QKAF. We have started to do a lot of charitable work based on altruistic principle. এটা পরে ফেসবুকে আমরা দিব আর কি advertisement of the QKAF Foundation, আমরা কি কাজ করছি বাংলাদেশে। And then this year, এই বছর, I joined Harvard University again. আর আমি এখন একটু শেয়ার করি, if I can, to show you the website, কোথায় কাজ করছি. So here I am. I'm a senior staff scientist. So it's not an academic position, meaning I'm not a faculty. I'm a pure researcher, basic scientist এখানে. And institute's name হচ্ছে the Wyss Institute. It's a Harvard Institute, Harvard University. It started 10 years ago, where Hans-Jörg Wyss, a Swiss billionaire philanthropist, gave around $500 million. So that's how the Wyss Institute started. And the goal of the Wyss Institute, which is a Harvard University institute, is to work on translational work. So in biotechnology, that means that you take basic research, basic ideas, basic scientific discoveries, either in vaccine, therapeutics, meaning medicine, or diagnostics. So either at MIT, Harvard, in our local community, all the researchers, professors, faculty, and other researchers that are working on basic ideas in those fields, we translate that, meaning we take that and turn it into a product, either by creating patents, intellectual property, and then licensing it out to various companies, various big companies, say Roche Diagnostics or Pfizer, GSK, for example, So GlaxoSmithKline or Novartis, all the big companies. So they might license our IP. So suppose me as a researcher, I come up with an idea, an invention, and I create a patent. They will take it and they will translate it. So it's translation, meaning it will be turned into a product that's commercialized that people can buy. So it's in the for-profit model, but we are a non-profit organization, meaning Harvard University. So we create all the technologies, do the basic research, then it gets translated. The other way of doing it is that we as researchers can also start our own companies. So for example, if I come up with an idea, which I'm working on many types of diagnostics, say in COVID diagnostic, we can go and then start a company, a new company, and which will create these diagnostics. So that's what translation means. And it's very important, especially in applied biology, where the end goal is to deliver interventions, meaning either vaccines or medicine or diagnostics, to the people who need it the most. And one of the things that I am doing in particular, I'm leading this platform called the Diagnostics Accelerator. The idea is that right now, and this is all related to biotechnology, and I'll stop talking in a few minutes and then we can have a conversation. But what it takes 10 years, 20 years, 30 years to take an idea into it and make it into a product. So what I want to do is build this platform within the Wyss Institute and with all other members, a platform that will accelerate that process, meaning it will make sure that the right type of ideas, because not all ideas, they might be great, but they may not turn into a product that can save lives. So the idea is to accelerate, make it quicker. And for that, many people have to be involved. It's not just researchers, it's people in industry, people in hospital setting, meaning clinicians, people who treat patients. Patient advocacy groups need to be involved. And in the end, someone has to pay for it. So in the US, the insurance system, the insurance companies, they have to pay for it in the end. So we have to get a lot of stakeholders involved to make sure that the best ideas turn into products that can go and help people, help save lives. And one of my goals is to make sure that underserved population, there are 3 billion people in the world that live on $3 a day. There are a lot of poor people, even in the US, homeless people here, they will never get access to these types of interventions, say diagnostics or medicine, unless some of us really focus on providing these diagnostics to them. And COVID is one example. And in the US, we have seen that there are many people who cannot afford it are not getting the testing, diagnostic testing. And that's a big problem in the US also. So that kind of summarizes what I do, what I am involved in, and what my passion is to make sure that inventions turn into products, and also to make sure that people who are underserved, underprivileged, also have access to them, can get access to them. So আমি এটাই বলে এখন শেষ করি আমার my introduction, right? So then Shamim, yes.
Thank you for your nice introduction. And I'm a little bit wondered that why did you start to work in a health sector, biotechnology sector? Which actually is there any cause that you change your areas to and start to work for this biotechnology?
Yes, Shamim. So again, thank you. I should have said in the beginning, thank you for organizing this. I know, we all are very busy, and you asked me a few months ago, and here, and again, as you know, COVID is again surging everywhere. It's like more than 45 million people in the world, but the US, more than 9 million people in the US have now been diagnosed with COVID, and more than 200,000 people have died in the US, the largest proportion for such a wealthy country. So we have all been very busy. So again, thank you for inviting me to this. I know it's very important, and especially being a Bangladeshi, my goal, and now to answer your question, is to give back. Although I'm in the US, I am in a very privileged setting. My family is doing well, I'm doing well financially and very safe. So So that I very much appreciate and very thankful and grateful for. But, you know, I'm origin is Bangladesh, right? And I've always come back home. My parents are there, and I have other family members. My friends are here, and Shamim I've known for many years now. And we have worked together in some ways, and hopefully we can work more. But the motivation for me to be involved in anything to do with Bangladesh is because I want to give back. And being in the US, and I know there are many Bangladeshis around the world, we all want to do something for our country. Although I'm a US citizen now, I'm still Bangladeshi at heart, right? And that will never change. So the reason I left physics, which is pure knowledge for the sake of knowledge, and there is very little application, especially in Bangladesh, that I can bring back unless it's something translational, some device that I make. So the type of work that I did led to a Nobel Prize in physics for my advisor and my director. And so I was involved in a Nobel Prize winning project, and that was great. But there was no path for me to give anything back to Bangladesh. So I, on purpose, switched that in 2000 to biomedical science. Before that, I was in software engineering, again, making my move towards public health. And always my goal has been to do something so that I can eventually help Bangladesh in some way. And the last thing I will say, so that's my motivation, is not, and people suffer around the world, and it's not necessarily Bangladesh. So everywhere around the world, people who are suffering, people who are especially don't have access to a lot of these things. So that's another goal of mine. So I want to help in any way possible, and that's one of my main motivations for switching.
Thank you, Rushdy. I'm just, I know that you have a long experience as a biomarker hunter and focused on translating this biomarker into life-saving diagnostic tools. At this moment, as you are working for COVID-19's diagnostics tools development, can you a little bit share with us about the biomarker hunting perspective? Because in Bangladesh, this high technology perspective is a little bit, not updated. Can you just give us
Sure.
a little bit understanding, and how you can translate this biomarker into life-saving diagnostic tools?
Sure, Shamim. So biomarker hunter basically means looking for biomarkers. So what is a biomarker? And before I go to that, I will say that before I switched to biomedical science, when I was as a physicist, I was looking for neutrinos. So I was a neutrino hunter. Neutrinos are these fundamental particles that go through the universe. So I've always been a hunter. I've always been looking, and so now I'm a biomarker hunter. So what is a biomarker? So for any diagnostic, for example, let's focus on COVID, right? Because it's a pandemic, we all are suffering from it. So COVID-19, if you want to diagnose it, you need to look for something, say in the blood or in your sputum or in your saliva, right? So or in your nose, right? You have to take the sample and then you have to look for something. What is that something? So those are the biomarkers. So for the virus, say COVID-19, you just look for the virus. Either it's RNA, DNA, so it's a molecular test, or you can look for the proteins of the virus, right? So proteins are the building blocks, the DNA proteins, these are all the building blocks for all living things, right? Us, monkeys, plants, anything that is living has DNA, RNA, protein. So you either look for proteins, or you can also look for antibodies. So when someone is sick, suppose one of you get the cold, the common cold, shordi kashi, right? You got it from some virus. So you need to identify what virus, and based on that, or is it bacterial, or is it fungus? So that is a biomarker. And then the other biomarker is within the host. So if you get sick, our body produces, say, antibodies, right, to go and fight the disease, or they produce various types of cells that are already there, make the cells like T cells become aware and trained to learn what the disease is and to fight it, right? So these are our internal police, our internal army within our body that goes and creates it. So you can look for biomarkers as in proteins that the host is producing, or you can look for the proteins or DNA, RNA that the virus is producing, that is with the virus or bacteria or the pathogen. So that is biomarker hunting, and you have to go look for them. So the first stage for any diagnostic, so for COVID-19, say diagnostic, that I've been involved in not just the basic research, but also evaluating diagnostics from many companies from around the world. Now in Bangladesh, you might think that we cannot do it. I'm sure there are people who are doing it. There are very fine researchers within Bangladesh. And we do have the capability, and that would be one of my goals, is also to help in the process sometime soon. Maybe Shamim and I can work on that also at some point, right? So the technology advanced in such a way and has been made easier to implement. So in Bangladesh, there's always, in the end, you need funding, you need money, taka. In the end, no matter where you are, you can be on the moon, you'll need something to, money to buy something, some form of bartering, so that you can exchange. So you always need money. So we have to find the funding, first of all. If you have it, then Bangladesh, you could do it anywhere. You can do a lot of things, even sitting in a cave, for example, if you have the right instrument and the right support. So I hope that answers your question, what the biomarker hunting and how we can do these things even in Bangladesh, but we just need the right design, the right type of people involved, and some funding.
Right. Rushdy, just I'm a little bit wondered about, if you look at in Bangladesh, we found that there are lots of infection, and recently ICD they did a study, and my personal observation also that our poor people, like slum people, are less. I should say that mortality rate is very minimum among them compared to the middle class and rich people. Do you have any comments about this phenomena among the poor people in Bangladesh?
Yes, so I can make comments. It's not going to be very scientific. And the reason I say it is COVID-19 is very new. It's still 9 months. We're still learning a lot of things about it, right? For example, so it won't be very scientific right now. Yeah, I can give you my perspective. But before that, I want to mention one thing about biomarkers. So I have been involved in finding biomarkers for TB, TB diagnostics, and we recently published that result. So TB in Bangladesh is a high burden for TB, just like in India and in China. And I'm working right now, even at Harvard, to come up with a diagnostic, a blood, so that you can take finger prick blood drop and diagnose TB. This does not exist. This will be very new. And in fact, we can use blood to even diagnose COVID-19. We're working on it. It's still very difficult, but so those are, again, just to wrap up the biomarkers. So I have biomarkers for TB. I'm working for biomarkers for, say, Alzheimer's, cancer, and other diseases, okay? So now coming back to your question about mortality rate. So for COVID-19, the rate is higher than flu. So it's much deadlier than flu, but not as bad as we initially thought. So maybe it's, under 1%, something like that, but it's still worse than flu. You do not want to get COVID-19. Now, in the US, I can tell you that, and it's understood that mostly people who are elderly, who have underlying conditions, underlying other health conditions, they suffer the most. So the mortality amongst them is much higher. Young people have a much lower mortality. Right now in Bangladesh, that is also true. Now this disparity, this difference between why the wealthy and the privileged suffer more versus why, say, in the slums, bostite keno manush mara jacche na, why is that, right? So there's few ways that we can answer it. One is when we get a disease, right, we have a response, right? How good is your immune system, right? So the reason the elderly and with underlying conditions, they suffer more because their immune system is not as strong. Now, even young people, there people have died, younger people, even babies have died from COVID-19. So it's something to do with their immune system, the communication or the interplay between an individual's immune system and how the virus reacts to it, right? So now, in Bangladesh, why, in the poorer areas, they're not dying as much as, say, in the more rich areas? Well, it could be that their immune system, first of all, is much stronger, right? That's one easy thing to say, but we have to go and show that, right? We have to prove that is it really true or not. So that's where the scientific part comes in. This is, we can assume that there's something going on, and we have to also assume that they're also getting infected the same way. One is that you're not getting infected, or you're getting mildly infected and then you recover. The other is that if they're all getting infected at the same rate, then their immune system is stronger, most likely in some way. Now, there is some, not study, but some idea that, and people are looking into it, that COVID-19, it came from, say, bats, it somehow jumped to humans, that it happened in Vietnam, in some of the caves, potentially, and it may have existed earlier, and that some people have already developed the immunity. So it's like giving vaccination. So they've been naturally immunized some way. So it may have already come to Bangladesh earlier, and it may have already spread, and people have already mounted an immune response, and they're already immune to it. So one is they're exposed earlier, they've been naturally somehow vaccinated, and now they're immune. It's like getting a vaccine. And the other is that they are just, immune system is much stronger because, they live in not clean areas, they're not, they're much more exposed to all types of pathogens. So that's also possible. But for me to say that with certainty, 100%, we'll have to do studies, right? That's the only way to scientifically say if I'm right or not.
Yeah, in that perspective, can you little bit share with us about the idea and functionality of human organs in chips, as you are working on these issues? Do you have?
So organ and chips, so that is not my research area. So that is, at the Wyss Institute, Don Ingberg, who is the director and founder of the Wyss Institute. So he developed this technology. So the idea is that in the way we translate anything, you have to eventually try it on people. So imagine if you could create all these organs, our bodily organs, like the heart or liver or whatever, blood system, all of that on chips. So it's artificial, right? But they behave exactly like our body. And so that's the idea of putting organs on chips and doing a lot of the studies on the chips, because that's safe. No one is getting hurt, and you can do all of those and figure out what medicine works better, what diagnostic works better before you try it on human beings. And eventually what will happen is that through tissue engineering, eventually at some point, maybe very soon, already we have all these transplants, right? Heart transplant, liver transplant, kidney transplant. You will be able to create your own, from your own stem cells, for example, extra set of eyes, all your organs that you can just have access to, that if you lose, if you need your own kidney, a kidney replacement, you just go and say, okay, I have my kidney, an extra pair, because it was grown and it's artificial, but it's your own. It's a human kidney, but your own kidney, so that you don't have to go and look for other kidneys and there won't be any rejection. So we are just a part of all these different, now we are not talking about, consciousness and soul and none of that. We're just talking just like engineering elements. The body's parts of this and that, you make it up, put them together, and then you get a human body. So you can imagine making all the different parts of our bodies at some point, and it's already happening.
Okay.
So the organ on chips is just, ways to do all the testing.
Okay.
Not on humans, but on human organs.
Okay.
In a safe way on chips. Yeah.
So what do you think about making the brain? If you can make eyes and everything.
Yeah, people are working on organoids. So these are organoids, mini brain. So one of the things in brain research is very difficult. So I'm very interested in that is you cannot really test on human brains, on live human beings. It's not possible to go, let me change this part of the brain. So if you can have a mini brain,
okay,
which doesn't have consciousness or anything, but all the cells are there, but a much smaller version on a chip, you can try, say, some Alzheimer's drug on it and see if certain things happen, right? Okay. And if it behaves, you have some readout. So think of it as like an engineer. If there are engineers on this call, you can think of it as just an engineering task. If you can create something that behaves like the brain, and then you can do your testing on it, then it's much safer.
Okay, that's interesting. Rushdy, can you just also share about what is FcMBL? Maybe I'm not, and what is the, effective for infectious disease like for COVID-19?
Yeah, so this is again coming out of the Wyss Institute. A colleague of mine, Mike Super, his name is. They've created this a while ago, and it can be used for diagnosing all types of infectious diseases, FcMBL. And I don't know all the details about it, but again, I shared the website. All of you can go and look at all the details. So I cannot talk much more about all the details, but it's another technology. And they've also started a company outside of using that technology. So it can be used in all types of diseases for capturing all the bad things that are in our body, in a way of capturing some of them to do either diagnostics or even come up with medicine. Yeah.
Well, as you said, the technology is using in different developed countries. But if you look at that in Bangladesh, when COVID-19 came, then we heard that IEDCR and government trying to, tracing contact tracing. So do you have any suggestion like, how technology can help for contact tracing? And my, also little bit, more understanding and your perception about, do you think that this type of technology will be useful for Bangladesh? Like, it is a very densely populated country, and people, move around like, they don't care about other issues. So what do you think that, is it useful technology in Bangladesh?
Yeah, so contact tracing. So suppose I get COVID-19, me. Then what does it mean to contact trace? So I think most of you are familiar with the concept, right? That means that anyone that I was in contact with over the last many weeks, we need to identify them, right? And let them know you are in contact with Rushdy, right? He has COVID-19. You need to isolate yourself, and then they will, do their own contact tracing. Now, how do you implement that? The idea is to stop the spread. You want to stop the spread of coronavirus, say COVID-19, and once someone is diagnosed, you want to find all the contacts. So now there are the traditional ways of doing it, and this is epidemiological, right? In epidemiology, they've always done this. You call, right? So suppose I get it, an investigator will come and say, okay, who have you been in contact with? And I will say, here are the 10 people. Then you have their contact information, phone number, email, and then they will call them, right? So that's how the traditional way of doing it. Now with using technology, you can have an app on your phone. Everyone's got a phone. But here, the issue of privacy comes on. So you can download this app, and many exist, but it has to be at the government level, at the community level. Everyone has to participate. So suppose in a village, there are 100 people, right? And they all stay in that village. And they all have this app, this technology. And this technology will tell someone who has access to all that information that who they have been near, right? Because with technology, you can monitor all of that because it's sending out signal and you capture all it and you know who's been, say, within 6 feet of you. So all that is technologically possible and it is being done. So China is the best example. They do it, but they have a very strict, almost authoritarian, rule, right? So they can say everyone has to do it. If you don't do it, you're going to jail or you're being fined or this and that, and they obey, they listen, right? So there, it's absolutely possible and they've done it. Now in the US, it's almost impossible to do it because it's a very individualistic society. No one can tell anyone, even the government, you cannot, it will not work. So it has to be from within a community, everyone has to agree. And they have to say, okay, I agree, I sign up and I will follow. I will let you, someone has to monitor all of this, all that information. I will give up my privacy because someone has to know where I've been everywhere. So you can imagine all the issues, right? So it will not happen in the US. In the US, contact tracing is happening through traditional method, phone call. Hundreds and hundreds of thousands of people are calling thousands of people. Now, because in the US now the rate is so high, it's almost impossible. There are only so many people you can employ, pay to call all these people. So it's very difficult. So in Bangladesh, in this dense setting, as I said, if everyone obeys and says, okay, I can be monitored, I allow, say, the government to monitor all my actions and everything. So if anyone gets COVID, just like in China, the China model. So it's possible, but I think realistically, like in India, I don't think it will be possible in Bangladesh, in a dense setting like this, unless we give up our privacy and all of that and allow us to be tracked. It's not really feasible. But the traditional method is feasible because then, you can call and do it that way. So, and that needs to happen.
Thank you, Rushdy. Can you a little bit also share about serological letter for assay? Would you also like to follow up your article on antigen and serology-based SARS-CoV-2 immunoassays for our audience? I know that you did work and you have a past experience about it. Can you share with us?
Yes. So let me share my screen. So I have been involved, as I said, from Harvard. Now, in Harvard, there are many hospitals that are teaching hospitals for Harvard Medical School. So the big one, the two big hospitals, and they're one of the biggest, also very well known in the world, is Mass General Hospital and Brigham and Women Hospital. In fact, our daughter, Aniza, who's now 17, was born at Brigham Hospital here. So Mass General Brigham is the Harvard hospital system. So in March, we started this center called MGB Center for COVID Innovation. And there is this platform or program called the Diagnostics program. And let me just go to the next page. And there were 4 different pillars, 4 different programs. One is devices, the other is diagnostics, there's data analytics, and therapeutics, meaning medicine. So I was in the diagnostics pillar. And the missions of the diagnostics pillar was to identify, assess, meaning evaluate, validate, meaning get all the testing, COVID-19 testing that are in the world, get the ones that are the best, and have them evaluated in our clinical labs using samples to make sure that it really works, and then to implement it, make it accessible to people. So that was our goal. And I will just show this slide where the structure is direct to consumer, meaning any diagnostic that can go directly to the consumer. So for example, it doesn't exist right now. I can say, go to Amazon and buy a COVID-19 test and it will come to me. I will apply the test and get the results at home. So that's what direct to consumer means. And that's what I was working on and still am involved. So I was the group leader for this working group, direct-to-consumer diagnostic working group. And what we did was we looked at the literature. This is in March and April. We looked at the literature, we did clinical surveys, we did a horizon scanning, meaning we looked at everything, all the tests that are out there, came up with a number of tests, make sure that they perform well, meaning sensitivity, specificity, what the companies, these are now company tests, right? The company is making and selling. And then we asked them to send it to us. They sent hundreds of them for free so that we can then make sure that they work properly. And then we advised many people, for example, the FDA, which is the federal department that takes care of giving approvals to various tests. So we work with them also to advise them. And out of that came a publication that Shamim here is mentioning, our results. And that I can share on Facebook, link to it, or Shamim can share all that link. And if anyone has questions about any of them, because I know this time is short now that I'm talking to you, you can always reach out to me and I can share my email address and we can go directly and I can answer any questions that you might have. So I will stop here so that we have more times to discuss, but that's what we did. And we are still doing it, is bringing in all these tests and evaluating them.
Rushdy bhai, I just want a little bit wondered about, if you look at that, like 5-6 years ago when we sit together and discuss about the biobank and other issues, that time we had a lots of dreams. And we thought that, Bangladesh is a potential country to establish this type of, structure, especially biotechnology issues. And last year, I was a little bit, engaged with clinical research activities, and I heard that India has developed a very good infrastructure for clinical research activities, and they are earning, huge amount of money in this area. So my question to you, that why biotechnology is, significantly important for health perspective, and if I just like to hear from you, like why it is important for Bangladesh, why government should invest in this area.
Yeah, so biotechnology, I think everyone would appreciate and understand why it's important, right? Anything that is in the field of medicine, meaning therapeutics, vaccines, or diagnostics, those three things, right? Any inventions happens in the biotechnology world, the technology that's used in biology to make these products, then that go and help and save people and save lives. So the importance of biotechnology should be clear to everyone why we need it. And people around the world, scientists around the world are involved. Now, in the end, as I said, you need infrastructure, you need, and that means people power, the brains, right? The training, the education, and of course, government support. The US spends billions of dollars, all countries, a big percent of their GDP goes towards health and wellness, right? That's the majority spending in the US in the field of health. Now, India, they have advanced quite a bit. As you know, they have great infrastructure, or they're building it. And they're, for example, the India Serum Institute, right? I mean, they're the #1 vaccine manufacturer in the world, right? But they didn't start out like that. They started small. If you look at their story, India Serum Institute, I think that's what they're called. And now they're going to be involved in manufacturing all these vaccines for COVID-19. Now, can any of this happen in Bangladesh? Of course, all of this can be done in Bangladesh. And I've met many, very smart people there, and we just need the support of course, the government will play an extremely important role to advance this, and the basic researchers that are in Bangladesh and the engineers. And as I said, I have started some of the work, and you and I talked about some of it. And as I'm hoping that I can be more involved, but the importance of biotechnology is it's very clear, and Bangladesh can do it. That's one of the reasons I left physics, because now, doing basic physics research, which is trillions of dollars, it might as well be. It's impossible to do that in Bangladesh now, but in the field of biotechnology, we can definitely do it. And there are many companies already in Bangladesh, I'm sure, are doing it and working on it. There are many pharmaceutical companies in there, they're already working on it. So we have some of the infrastructure, and it can only get better. So I'm happy to be involved in any of that going forward.
Do you think that Bangladesh is a prospect in terms of biotechnology, economical prospect, as well as to catch the global market?
Yeah, no, I think so. But I don't live there now. So for me, it's difficult for me personally, to get involved. And I have been involved. But we need more people, and also the intentions have to be right. It has to be very altruistic, right? There is, in biotechnology in the US, it's one of the most lucrative industries. They make a lot of money, but then the people don't benefit as much, even in the US, right? So there is always that balance, right? I think it's possible. We just need the right type of people, the right support, and the willpower. This is not really answering your question specifically, but I think you understand, to do anything successfully in any country, you need people, infrastructure, you need government support, you need local support, and you need the education. We need to build the next generation of biotechnologists in Bangladesh. Look at the software industry. And I just started a software company in Bangladesh, and I've been involved. In software outsourcing, Bangladesh is doing very well now, right? I think that we have about 500,000 or maybe 1 million freelance software engineers, developers in Bangladesh. So, and look at the garments industry. When they started, they're one of the top now. They have been, right? I know with COVID-19, everyone is suffering, but new industries have started in Bangladesh, right? So it can happen too. And it is, and I'm sure it will happen. Absolutely will happen. So
in that perspective, if you become a leader for, developing biotechnology related industry in Bangladesh, how you like to start, and what is the step you will follow?
Yeah, so one thing that it has to start with. So I will talk about anything that any invention, again, it targeted towards helping people, right? Saving lives, either through, say, vaccines, medicine, or diagnostics. So to be impactful in Bangladesh, right? To create a business where the business is profitable and they're not greedy, like in pharmaceutical, I think everyone knows in the US, extremely, all industry, they're all very greedy, right? It's for-profit company, right? It's a capitalist system. But you don't have to be so greedy. So let's assume that we start a company. It has to have impact on the people in Bangladesh. So by that, I mean, we need to understand what are the needs. What are the clinical diagnostic needs, right? For example, we know all the diseases, and I'm working on TB. As I said, TB is a big problem in Bangladesh, and I've been working on it for 14 years. It's very difficult because there's not much money to be made in TB because it's mostly poor people die in poor countries, right? So these are the disenfranchised people. So my point is that we need to understand what the basic needs are in biomedicine, in biotechnology, and then look for products that we can help build within Bangladesh, right? Within the Bangladesh community with using Bangladeshi scientists, right? With our help, meaning other Bangladeshis that are around the world, and doesn't have to be Bangladeshis. We just have to make sure that we have the right type of people working on a specific problem in Bangladesh to help. So it could be clean water, delivering clean water to the rural areas. There might be technology that's cheap enough, and I know of some, for example, how to filter the water and make it clean and drinkable, right? Because a lot of diarrheal disease is a big problem because of sanitary issues, because of the water system. So imagine working on something like that, which I have some ideas of maybe how to do it. I'm just now thinking about what's potentially we can do. Delivering clean water to people. How do you do it in a cheap, efficient way? And we can set up a company to do that. And the way we do it is go license a patent. Maybe it exists somewhere, and do it in Bangladesh, right? But for that, again, you need the infrastructure, you need the buy-in from the government has to provide some support, and then you also need some investors, right? Some money, and you have to start in that way. So that is my recommendation. There are many problems that we can solve in Bangladesh, and I'm working on a number of them, and we can do it. We just need the right people, some money that needs to come from investors, and there's a lot of money in Bangladesh. We can maybe go after investors within Bangladesh and see if anyone is interested. So these are the basic ideas, basic parameters of how you can start a company, but it has to be driven by problems that we want to solve in Bangladesh.
Rushdy, I have one very interesting point just came up into my mind. As your father, respected Kholiquzzaman sir, Ahmad sir, he's an economist, but he also lead civil society, different angle, but environment and climate change issues is one of the major areas, and he represents Bangladesh for climate change and environment perspective too. So when COVID-19 came up, then we thought that this is some sort of conflict between nature and human, exploit the nature, as well as the business perspective, open market economy, and other perspective too. So what is your experience, and how do you like to see your diagnostic tool is going to help us in the next, another virus attack on the human beings? How do you like to explain this, upcoming other, dangerous situation for human beings?
Yes, so this pandemic is, once in a century, right? This event, it's a global pandemic. Everyone is suffering from it, and we are learning a lot. And what would be unfortunate is that if we don't use this crisis to learn from it and to prepare for the next one, right? There will be others, especially with climate change, as you mentioned, is happening. The hot zones are shifting, the pathogens are shifting from one location to another. And one of the examples is Zika, when it happened in Brazil, because of, that was the first, I think people are documenting as the first pathogen, pressure on a pathogen that moved it to that location due to climate change. Right? So, to briefly answer the question is, again, in Bangladesh, there has to be appetite for long-term thinking, right? This is preparing for the future. And it's not just Bangladesh, it's everywhere, in the US, right? Where I am. If we now, after a vaccine comes and everything goes back to somewhat normal and we forget this and move on, then this would be a disservice to humanity. And the same thing in Bangladesh, we just have to make sure that, and maybe through your organization, you need to get together people, thinkers within Bangladesh community from all levels, from the business community, from the scientific community, from government, from the development community, like my father, get them involved, and have a session where what have we learned, because it's difficult now since we're living in a pandemic, but we shouldn't forget to come up with all the lessons that we're learning and how to implement them so that next time, and it will happen in some way, especially with climate change, is being a big problem, that we have to prepare for it. So yeah, we need to have more gatherings like this with a lot of other people and come up with an action plan, really. That's what I would recommend.
I'm just sharing with you that if you look at, in terms of priority perspective, these biotechnology issues, you know that Ministry of Health is being implemented a 5 years program called SPNSP, and within this 5 years program, there is 29 operation plan. And among these 29 operation plan, one operation plan is MIS, that is, information system for health, under the DG Health, health services. And within these MIS, there's a little, amount of money for biotechnology that is run by one program manager, and they don't have any that focus and extend these things in terms of the opportunity it has for Bangladesh. But we're lucky that like 5 years ago there was nothing related to the biotechnology, but these 5 years they have just included a 1 point compared to our need. So if I want to start advocacy to motivate our Prime Minister, motivate our policymakers to invest more in biotechnology, what is your suggestion? How can we move forward, and how you can help us?
My suggestion would be, yes, so in Bangladesh, to interact with the government and other stakeholders, right? So that arrangement, that getting people together will have to come from within Bangladesh, right? So I cannot really advise you on how you do that. But the other thing that I can say, I would be happy to be involved in something like that, where I can give my perspective, like what we're talking about now. But if you can arrange, if you can get key stakeholders, first of all, you need to identify, I think, the right people, the people who, not just the right people, but who are motivated, are really altruistic, really want to get involved in this within Bangladesh, right? Get us together, and then from around the world, they're all of us, many of us that are around the world. You have to create a list of them, get us together, and you have to start that dialogue. Because we need to agree on what to do. And then in the end, there has to be money involved. Someone has to pay for it, right? But unless we are all working together on a common understanding, common language, meaning language of understanding, and a vision, but what are we doing? It's very difficult to speculate for me to say, do this or do that, but we need a forum, really, to start the dialogue. I don't know if it's happening in Bangladesh. Maybe it is. So I will push it back to you to say, why don't you and other stakeholders get that together, and let's start the dialogue and see where it goes, because you need people involved in this, right? So that would be my suggestion and my request.
I just want to know one more thing. Like, as you mentioned about that in USA, private sector, they invest money, like biotechnology and other areas. And they're investing money because they are earning money too. And if you look at in India, I found that there are lots of private sector, they have also invested in biotechnology sector areas, and they are like $6 billion they earn in each year. So I think that this is a very big opportunity for Bangladesh too, as a developing country, and that access to people, access to biological sample is very easy compared to the other country. So what do you think that why Bangladeshi entrepreneurs and private sector is not coming up, and how we can involve them?
No, that's a good question. It's my question too. In fact, as I said, it's very difficult for me to know what's happening within Bangladesh, what the infrastructure is, what the appetite is. So in fact, I would ask you the question. I can only guess, but I don't think we want to be guessing here. So in fact, I would ask you, Shamim, why don't you tell me, we don't have to do it now, but why is it that? And I don't have any visibility. So for example, if you could tell me, are there investor groups in Bangladesh, right? Are there venture capital groups in Bangladesh? I'm sure there are, who'd be interested in investing. Now in Bangladesh, as you know, there are lots of people with lots of money, and I'm sure they want to invest. And these are all good people. They want to invest and be profitable, which is great. I mean, that's how the system is. And then they may also want to give back as a socially responsible act. So if I were to do something in Bangladesh, start a business, right? I have an idea. I have, say, a patent. Then I will have to go to a list of venture capital firms, say in Bangladesh, or just wealthy individuals who might want to listen to our ideas. Suppose you and I come up with an idea. Here's a need. It will solve this problem. It will get this much return on your investment, and it will also help save, a lot of underprivileged people. Are you interested? Here is the budget. Are you interested in investing in this? So it's in Bangladesh, and that is happening because there are so many businesses, and they do all these, business pitches, right? So this is how I would approach it. But I, from here, have very little idea about, the landscape in Bangladesh about investing and who would invest and what money is involved. So there, I would ask you and others in Bangladesh to provide that information.
Oh, but Rushdy, I'm just sharing with you that I'm a little bit hopeful because during COVID time, I met with several entrepreneurs and businessmen who were investing money for developing different tools for diagnosis as well as for ICU, ventilator, and other things. I had a very long discussion. We did a little bit of work with one group. They were developing the ventilator for Bangladesh. So people are interested. I think that those have money, they are also a little bit interested. But as you said that let's make a plan for organizing a private sector people and share with them our ideas and ask them to look at this business. So it's a technology business. It is a this business is a technology, but this is directly helpful for the human beings. So, and this is a good amount of benefit they also can get. As India, Sri Lanka, Singapore, Malaysia, they're getting, and Bangladesh has a potential scope in these areas. So I will be really happy, Rushdy, when you come next time, organize this type of seminar. But in the meantime, I can also talk with different private sector to look at these issues. However, finally, do you have any final comments for Bangladesh as we are expecting that second wave of COVID is coming for Bangladesh? So that during the last few months there was a lot of discussion related to the diagnostic tools for COVID, like antibody test tools, antigen test tools, Ganashastra and others. There was a lot of discussion happening. So what is your suggestion how Bangladesh can handle this second wave in terms of diagnostic perspective?
Right. So since we're getting, in fact, getting close to the end, I will just end with this. That's a very good question to end on. As you know, in the US, the second, or maybe call it the third wave, has started, and it's exponential. It's reaching to very high levels. In Europe, as you know, it has started. Boris Johnson just announced that a lot of the restaurants and other places are closing. It most likely will happen here in the US. We don't have any vaccines yet, and that will take sometime next year maybe. And then there's the issue of distribution, right? Now in Bangladesh, we don't have the picture of how many people are really infected because you're not doing enough, you meaning in Bangladesh, the testing is only 6,000, 7,000 12,000, even if it was 20,000, you still don't know how many people are really infected. Now, one thing that you can know is, how many people are dying or being hospitalized. Maybe, right? The mortality rate is low, so that is very good. But people are suffering still. You don't want to have another shutdown, because then people will suffer even more as the economic hardship. So my advice would be, since we don't have the testing, and I don't think it will happen anytime soon, the right amount has to be millions and millions of tests have to be done. That's not going to happen. It's not even happening in the US. It takes still a few days to get results. So even countries, very wealthy countries with trillions of dollars that they're spending, we cannot do it, so that would be very difficult. And look at India, your next door neighbor, it's a terrible situation. They most likely will overtake the US in terms of number of cases. So my suggestion would be to practice the proper hygiene, isolate yourself if you're sick, don't go out into the public. Masking has been shown to be very effective in stopping the spread. It doesn't mean that if I wear a mask and you're in the room, it will protect me if you have COVID. But if you have COVID and you have a mask and you don't know you're asymptomatic, it will prevent some of those virus particles to go into the air. And that's the way virus COVID-19 is transmitting. It's mostly through contact and through aerosol droplets going in the air and people breathing the right number of it in. So advice is there will be another wave, it's happening. But in Bangladesh, since we don't know exactly what the first wave was, it's still, you do 10,000 tests, you get 20, 30% positive. That will always be the case. You'll never really know what that wave is because you don't have the right testing. So practice proper hygiene, proper social distancing, proper masking, protect the elderly people there because they are the most vulnerable, doesn't matter what country you live in, right? So be very safe and take care of the people you love around you. Make sure, if you are sick, it doesn't matter what type of sickness, if you have a cold, just stay home, don't go out into the public. So that's it. We all have to look after each other, be altruistic, think of the other person, think of the people around you, help them, help yourself, and be safe and healthy.
Well, thank you so much. To your last point regarding the elderly people, that we have lost lots of our, elderly people. Those are the really pillar of our country during this COVID time, and we're really sorry for this loss for our country. But as you suggested, to ensure the personal hygiene and ensuring the mask, we'll try to disseminate this information. Government is trying also to disseminate this information, but that our people are really a little bit, they don't want to carry anything. If you go to a street, there is no mask, people don't use this mask. But however, finally, as we lost lots of doctors, our senior fellow, we are praying for them. And those still with us, we hope that their life will be more longer and they will be safe. And Rushdy, thank you so much. I'll keep in touch with you. And I think this is a very fruitful discussion. We hope that your contribution and by your leadership, we can do something in biotechnology sector in Bangladesh. Thank you again.
Thank you so much, Shamim, and thank you, Tushar, here. And thank you, Eminence, for organizing this. And I hope everyone stays safe and healthy, those who are listening and those who will listen to us later on Facebook. Thank you so much, and I hope to do much more in the near future for Bangladesh and its people. Thank you.
Thank you.
Thank you, sir.